Myocardial infarction, more commonly known as a heart attack, is an interruption of blood supply to the part of the heart causing heart cells to die. This is most commonly due to blockage of a coronary artery, which causes a rupture of plaque and which is an unstable collection of lipids, fatty acids, and white blood cells in the wall of an artery. The resulting restriction in blood supply and oxygen shortage, if left untreated for a sufficient period of time, can cause death or damage of heart muscle. Classic symptoms of acute myocardial infarction include sudden chest pain, usually starting in the left arm or left side of the neck and covering the rest of the chest, shortness of breath, nausea, vomiting, palpitations, sweating, and anxiety, often which is described as a sense of impending doom. Women may experience fewer typical symptoms than men, but most commonly shortness of breath, weakness, and a feeling of indigestion and fatigue. Approximately one quarter of all myocardial infarctions are silent without chest pain or any other symptoms. Heart attacks are the leading cause of death for both men and women worldwide. Important risk factors are previous cardiovascular diseases, old age, tobacco, high blood levels of certain lipids, and other low levels of high density lipoprotein. Diabetes, high blood pressure, obesity, chronic kidney disease, heart failure, excessive alcohol consumption, the abuse of certain drugs such as cocaine and methamphetamine, and chronic high stress levels. A myocardial infarction occurs when an atherosclerotic plaque slowly builds up in the inner lining of a coronary artery and then suddenly ruptures, causing catastrophic thrombose formation, totally occluding the artery and preventing blood flow downstream. This is a picture of an angiogram. In difficult cases or situations where intervention to restore blood flow is appropriate, coronary angiography can be performed. A catheter is inserted into the artery and pushed to the vessels supplying the heart. A radiopaque dye is administered through the catheter and a sequence of X-rays is performed. Obstructed or narrow arteries can be identified and angioplasty applied as a therapeutic measure. Now, microscopy image above from autopsy specimen of myocardial infarct. This is 7 days after the heart attack. This is a micrograph of myocardial infarction 2 months after the heart attack, and the black spots are where the heart cells died, and it shows permanent necrosis. This is how myocardial infarction occurs. Plaque buildup in the coronary artery blocking blood flow to the oxygen to the heart, and damage and death of the heart tissue shown in purple. These are the 4 stages after myocardial infarction. First is the hyperacute phase. Second is the fully evolved phase. Third is the resolution phase, and fourth is the stabilized chronic phase, which is every single beat in a regular heart. Alright, this is another picture of a myocardial infarction, and it's insufficient blood flow to the heart muscle from narrowing of coronary artery may cause chest pain, and there's plaque in the coronary artery which causes less blood to pump through and the heart to start having a heart attack. This is a picture of what normal blood flow through the coronary artery looks like and what flow blocked by a blood clot looks like. On the picture on the right is a blood clot. And what happens is the blood goes, it hits the blood clot, gets turned around, and that's what starts the infarct. It's very, very painful and can usually not be stopped unless they do an angiogram or an angioplasty and stop it. Or if that doesn't work, it may result in open heart surgery.